Go ahead, ma'am.
Hello everyone. So my name is Dr. Sneha Balki. I am IVF consultant at Oasis Pune branch. So we will be discussing a important topic which is PCOD or PCOS. So this is a very common thing that almost 70 to 80% of women face nowadays, and it is something that we commonly encounter in our practice in our patients also. So let's go through this simple topic, but very commonly encountered topic. So, what is PCOD or what is PCOS? Let's understand the basics of it. So, PCOD or PCOS are one and the same things, and they mean polycystic ovarian syndrome or polycystic ovarian disease. So, what happens here is uh, a female, when she is born with a certain limited set of eggs in both of her ovaries. As she attains puberty and she starts having menstruation every cycle, what happens is these number of eggs that are there in her ovaries, they start depleting. So when the number of eggs in a particular lady is more than what is required, that leads to polycystic ovarian disease or polycystic ovarian syndrome. So the incidence or almost 70 to 80% of females have polycystic ovarian syndrome or polycystic ovarian disease at some point of life. So they encounter this quite commonly. Now, what is the problems that a lady will face when she has PCOD? So, first and foremost, there might be irregular menstrual cycles. So, when a girl attains her menarche or her puberty, she starts getting regular menstrual cycles. And in case these menstrual cycles are not occurring regularly, that is, when the menstrual cycles are set quite far apart, almost 35 to 40 days interval is there between two menstrual cycles, or maybe it's quite often like 25 days cycle she is getting, that constitutes as irregular cycles, and this is not happening at a regular interval. So every month she is having different cycles with different frequency, and this is something that she is encountering. So that is the first and foremost symptom of PCOD or PCOS. What can be the other symptoms or other things that a girl faces when she has PCOD is she might be having excessive weight gain leading to obesity. So what happens is due to irregular menstruation, there are many hormonal imbalances which ultimately lead to a lot of weight gain and leading to obesity. PCOD is a condition where there is a lot of male hormone in the body and it circulates in such a way that it can lead to some unwanted symptoms also, such as unwanted bodily hair or facial hair, which we call as hirsutism. And another one challenge that we see in mostly in teenage girls is having a lot of acne. So these skin conditions are also something that girls have to encounter when they are facing PCOD. So along with these things, what happens is when a girl comes to us for irregular periods, irregular cycles, and we take proper history, we do a physical examination, and we ask them or we prescribe them a few set of tests which help us in arriving at a conclusive diagnosis or a final diagnosis whether she really has PCOD or whether her problems are due to something else entirely. So, what are the criteria for diagnosing or for confirming whether you have PCOD or not? So, first is your history. You have irregular cycles or you have started having bodily hair. There is increased incidence of acne or pimples on your face. There is a sudden rapid weight gain in spite of your active lifestyle. So these are things that point towards the direction of a diagnosis of PCOD or PCOS. Along with this, we do a physical examination determining what is the grade of hirsutism and how much weight gain has occurred over what duration of time, which help us determine what is the degree of PCOD, what is the severity of PCOD. Along with this, to supplement this diagnosis, the confirmatory diagnosis is done by a ultrasound or sonography. So what happens in sonography? When we see the sonography, the ovaries are quite enlarged in a patient with PCOD with lot of follicles or eggs. Usually, the normal expected number of eggs on either side or in both ovaries should be around 8 to 12. If these numbers are quite higher and the eggs are placed quite close to each other so that there is a crowding of eggs in the ovaries, it causes PCOD, or that is something that we label as PCOD, like polycystic appearance of ovaries. So this is a conclusive diagnosis. Now, along with this diagnosis, there are few lab tests also which supplement or support this diagnosis also. So a battery of tests. There are a lot many tests that can be done to make sure that the what is the severity and what are the hormonal disturbances that are occurring inside the body, such as your second day of periods. We call you to evaluate your follicle stimulating hormone, your LH hormone, and the ratio of these two hormones. Along with this, as I said, there can be a high level of male hormone, that is testosterone or DHEAs. So these hormones can also be evaluated when when the female or the lady is facing hirsudism, that is body hair, and acne, and accordingly treatment is planned. Along with these hormones, there are another few hormones which also can contribute to an irregular cycle, such as thyroid and prolactin. uh, PCOD is a state where the body insulin is on a higher level, because PCOD is a condition of insulin resistance. So, such insulin resistance, when investigated, will lead to a higher fasting serum insulin. So, this is also one thing that helps us in evaluating the severity of PCOD. So, along with this, uh, any of the two criterias that I just said, if there is presence of any of these two criterias, then we call that okay, you have PCOD, and we will treat accordingly. Now, what are the causes of PCOD? So, causes of PCOD is basically the faulty diet or faulty lifestyle. Like nowadays, we have a diet that is very high in processed foods with a lot of preservatives. There is a lot of fast food and junk food that is included in our day to day routine, with less antioxidants, less proteins. So, all these things have a cumulative effect on severity of PCOD. So the diet changes and lifestyle modifications are the mainstay in any treatment of PCOD patients. So this can be the primary cause. Some patients, however, do also have a genetic predisposition. Like if their mothers or sisters have known to have PCOD, then they are also having a higher likeliness or higher chances of getting PCOD. So that is also one of the reasons. That can also be one of the reasons. Nowadays, we also encounter that the girls who are not very obese, they are lean and thin, but even then they are having PCOD. So here we have seen that earlier, as it was, PCOD was quite rampant in obese ladies, but nowadays even lean PCOD has come into the picture, which again reconfirms that the role of diet and lifestyle is quite important. So now we come to the point, like how do we treat the PCOD? So many a times what happens is few girls, they have some stomach ache or they have a minor urinary infection, and when they go and investigate or do a sonography, the sonography states that you have PCOD or polycystic appearance of ovaries, is what the report says. But when we ask them, like, do you have any problem or symptoms like irregular cycles or anything like that, then there are no such signs. So what happens? Polycystic appearance of ovaries can be commonly seen in teenage girls, which itself sets to normal as her age advances. So there is no need of any treatment per se in these girls. So after teenage, after their menstruation is established properly, some polycystic ovaries they treat themselves, or they become normal by themselves without getting any treatment as such. However, there will be a certain set of girls or certain set of women who might need a treatment for PCOD particularly. So the treatment of PCOD depends on a few things, like what is the age of the female. If she is in her teenage, then we leave her alone just with diet and lifestyle advice, and there won't be any need of treatment most probably in this case. However, if a lady is older, like 25 plus, and still she is getting irregular cycles with lot of weight gain, lot of body hair, a lot of facial hair, with acne, irregular cycles, then she seeks treatment for PCOD, and their treatment of PCOD is warranted. Another thing that is to be considered is whether a girl or a female is married or not. So even when she is married, whether she is planning a conception, that is, she is planning a pregnancy, or she doesn't want pregnancy at this particular time. So depending on these factors, we decide how the treatment of PCOD is going to work. So, the first approach to any issue should be that if there is an issue that is diagnosed, we should approach it from all sides, from all ways. Like if there is PCOD, we have to approach it from all four directions by diet modifications, lifestyle modifications, proper diagnosis, and then treatment of that cause. So, the first and foremost thing of utmost importance is changes in your diet. So, our diet is quite rich in calories. Okay, so calorie based diet or carbohydrate based diet is something that is contraindicated or should be modified when you diagnose a PCOD. So, complex carbohydrates, then protein rich diet, inclusion of green leafy vegetables, fresh fruits, dry fruits, nuts, berries, which are rich in antioxidants, is something that should be done at our own level in changing the diet. Avoiding any starchy food products with a lot of sugar content, some preservatives, some additives, artificial flavors, and outside junk, oily, or fried food is something that should be avoided. Second thing is to time your meals. So, timing of your meals should be such that towards the you can have heavier breakfast, a heavier lunch, but your dinner or towards the end of the day, your meals should be having lesser caloric intake so that you can process these calories at the night time, and your abdominal fat which surrounds the ovaries will keep on decreasing. So that is basically the target. Another thing is some lifestyle modifications are needed. So, lifestyle modifications, as in nowadays, we see that there is a lot of obesity, and even in lean people, there is a lot of sedentary work. So, because of that, what happens is the fat surrounding your internal organs is increasing, which is abdominal fat is increasing, and that's the reason why the ovaries are also becoming resistant to ovulation. So because of this, what happens is you are getting irregular cycles, and such females might also face difficulty in conceiving, that is infertility. So, when we diagnose, we have to change ourselves into a more active mode of our lifestyle by making some small changes in your daily routine, including a brisk exercise or aerobic exercise where your blood is pumping properly, where your heart rate is higher, you're getting some sweating. So, such exercises should be included in your day by day routine, where you're doing these exercises at least 4 to 5 days a week. So along with this exercise, you should be maintaining a active lifestyle throughout the day. Like if you have a sitting job, if you have a more of a sedentary lifestyle, a few things like doing some household chores or getting up and doing some movement around your office. While talking on phone, you can just start walking nearby. So few things, few changes if we make in our lifestyle, then those are definitely going to impact the PCOD. So diet and lifestyle are two important things. Another thing is, if you are planning conception at a later date, like you're not planning pregnancy currently, but you wish to have regular cycles, and along with that, you wish to control your PCOD. So here the treatment will depend on oral contraceptive pills. And oral contraceptive pills, what they basically do is they supply the hormones from outside which are lacking in the body or which are not forming in a cyclical way in the body because of non ovulation. So these hormones, when supplemented from outside, they stop ovulation altogether. And because the hormones are supplemented from outside, they lead to a more regular menstrual cycle, and you can control your other activities along with diet and lifestyle. So this is something that can be done on a temporary basis. Like once you stop your medications, you can assess whether you have reset your hormonal cycles in your body or not. And if the hormones are reset, then you can continue maintaining your diet and lifestyle modifications, and the oral contraceptive pills can be stopped henceforth. If you are, however, planning to conceive or you plan to get pregnant soon, and in these females, in these ladies, we have to avoid giving the contraceptive pills. So here the treatment depends on how what is the age of the female, how many years you have been trying for pregnancy, and what is the duration of infertility. So along with this, we have to plan what treatment best suits you, and accordingly your timed intercourse or IUI, or if the duration of infertility is higher or the age is higher, age is the female is older, then we might have to think about IVF also. So these are the few options for PCOD, and the best guide would be to assess you, to examine you, and the women who basically need treatment, they can seek the treatment with the help of an expert guidance. So if at all there are any questions with this session, I think we can proceed with the questions. So what are the two types of PCOD? Okay. So as we said, like there are two types of PCOD, PCOD or PCOS. So one is the obese PCO, where what happens is there is a lot of weight gain, and because of that, the visceral fat has increased. And PCOD, particularly, there is no development of a dominant follicle, there is no proper rupture of a follicle, and that is leading to lot of smaller follicles forming and leading to our infertility and irregular cycles. This is one thing. And nowadays, another type has come up, which is lean PCO. So in lean PCOD, the weight gain or the BMI is normal, but even then the PCOD is existing even after a certain age limit. So that is also common nowadays, and lean PCO is something that is difficult, a little difficult entity to treat. So what is the first stage of PCOS? So first stage of PCOS is basically what we call as polycystic ovaries. So what is polycystic ovaries? Your number of eggs that you have been born with, that the nature has bestowed upon you, are bit on the higher side. So because of that, it could be one of the reasons could be genetic predisposition, like the PCOD runs in your family, and that's why you have also gotten PCOD to certain extent. So what happens here is as you age, the number of eggs in your ovaries will keep on depleting little by little, and there will be a time where you will have normal ovarian reserve. So during this stage, the PCOD is getting resolved by itself. But along with this, there is also one of the side effects of this, you can say, is After that certain period of time, you will have lesser number of eggs also. So this time is best in order to conceive, in order to get pregnant. Any other questions? Yeah. So another question is, can we cure PCOS with medications? So PCOD is something that cannot be cured completely. PCOD reversal or PCOD control is something that can be achieved. So, like we discussed just now, that any issue should be resolved with a 360-degree approach. So, PCOD control or PCOD reversal is something that can be achieved with a good diet, balanced diet, with good lifestyle modifications, which something you can sustain over a longer period of time. Medications, yes, there are a few medications which are insulin sensitizers. And these insulin sensitizers, how they act is the circulating insulin, which is higher in PCOD, they reduce this insulin, and then it induces ovulation. So when a dominant follicle forms, it helps in the rupture of these follicles, which helps in achieving a more regular periods, more regular menstrual cycles. And the rupture of a dominant follicle will also help in getting pregnancy. So another question is, can I get pregnant with PCOS? So most certainly yes. PCOS is not something of an abnormality. It's not a disease per se. It is just a physiological variation that occurs between various women. Uh, just PCOD can definitely lead to a pregnancy, a healthy pregnancy, where you can conceive naturally also with proper management. And if at all it's needed, then we can go for simpler treatments like ovulation induction, IUI. And if those do not succeed, then we have to proceed to IVF. But pregnancy in PCOD is definitely possible, and with the right guidance and evaluation of the severity of your disease will lead to a formulation of right plan for you in order to conceive. Today's session, we will finish with today's session. If there are any ladies who wish to consult, who seek help for getting pregnancy, they can contact on the below helpline number and connect with your expert. Thank you.